Hi friends, good afternoon and welcome to our session YouTube and Instagram live. Sorry about yesterday, last time we could not do because of some emergency problem, but we'll do an Instagram and YouTube live maybe tomorrow so that we can compensate that 1 week loss of Insta and YouTube because it's the past about I think 2.5 years which I'm taking YouTube live and it has never been broken. So I suppose I'll take tomorrow and compensate for that one YouTube video I could not take. So let us go further and I hope you start asking questions. It's Ria, welcome. Ria Zahmad, welcome. So it's good that you start asking questions now so that we don't have any backlog of questions. I hope on YouTube everybody is there and you can listen. Just give me a thumbs up so that I can know that everybody is come online and we can start a session. Okay. Yeah. Thank you. Thank you for the hearts. So let us discuss some cases before I what do you call discuss few questions which you have put on. So maybe there are some cases where I have got good results with using some interesting remedies where we never thought of these remedies in these conditions, but it works in those conditions also. Now, for example, normally when we have some teeth symptoms, teeth symptoms, that pain in the teeth or eruptions in the teeth and caries in the teeth, there are few remedies which are very very common. Like we have Staphylococcus, Muxol, Calcarea Flor, Calcarea Carb, we have Hiparsulf, we have Sericia, Staphylococcus. But there was a case, where the patient had a typical symptom. I hope on YouTube people are listening because I know on Instagram people are live. So Dr. Sakshi, Dr. Vasim, all welcome. So there was a case where the patient had a lot of caries, and one thing was that in the same patient he had symptom as if the tooth is too long. He used to say मेरा दांत बहुत लंबा हो गया, मुझे लगता है इसलिए अंदर तक पूरा जाके कचरा जम गया, caries हो गया. So of course we got a lot of remedies. We gave him one creosote, we gave him fluoric acid, did not work. And I was reading the mathematica of Hiparsulf. Hiparsulf. It is written in Hiparsulf caries the tooth feels as if long, and Hiparsulf 200 cured that case. So these are very very interesting remedies. Sometimes we are very fixed that maybe Hiparsulf more indicated in respiratory complaints, Calcareca more indicated in these complaints, this remedy for this complaints. Of course, they are very important, but there is other side of the remedy also that you have to think about and read about so that your prescription does not mess up with the routine prescription. I hope you got this right. Dr. Riaz, welcome. Walaikum salam. Dr. Wasim, walaikum salam. So ये आपको हो सकता है समझ में आ गया हो कि what I'm into tell. I hope people on YouTube also are listening. So this was the first case, and there was one case also. There are cases, where the patient says that I have a habit, like I like biting teeth, like this, biting teeth together, and suddenly feels like biting the teeth, suddenly feels biting the teeth without any apparent cause. And now this symptoms becomes very important, biting of teeth suddenly without anything. So if this is a very important 3 marking symptom, a PQRS symptom of the remedy Apis mellifica. And you must have seen in your practice there are a lot of these are called gestures. These are called non-verbal communication. Sometimes you look at the patient and whatever the patient is doing in front of you, that is the entry point of remedy. So make sure that you understand these complaints very precisely. That's why in case taking when you're taking the case in front of you, you can analyze the case very well, you can judge the case very well, and you can use your observation to judge. That is what Hahnemann has told. Your observation is very important. If you have a keen observation, automatically your prescriptions are much better. So tendency to bite teeth together involuntary and suddenly, do think about Apis mellifica. Apis mellifica is a very interesting remedy and the only remedy in these complaints. Welcome Dr. Alexander, Dr. Rohi. As you go further, of course, then we have there are a lot of cases where the patient comes and just understand that teeth are discolored. No, discoloration of teeth. Yeah, there's a difference between biting teeth and chattering of teeth. There's a difference. So clinching. No, I have if you see the repertory, I have only in my clinch bite, clinch together and biting, actually you see like when you bite something in the mouth, actually the patient has this symptom. Now you can say bite states together like this and clinch together, very close to swallowing. The patient has a habit of swallowing, but in swallowing the biting may not be there, but in biting actually the biting is there, and clinching is that clinch together. The patient has a habit of just putting the both the jaw together. Biting is actually biting the jaw as of chewing motion, and chewing is without biting. These are the three differentiation, because it is important to understand, because see, clinch together, teeth has a desire to clinch together. The remedy is absolutely different. As I told you, involuntary biting would be epistemal, clinch together would be phytoleca, hyoscyamus, lachesis, I think podophyllum also. So there's a difference, and there's one symptom also which is very common. You can see that cases in case of convulsions or epilepsy, clinched firmly, clinched firmly. And if you see the remedies in clinched firmly, those remedies are basically indicated in epilepsy and convulsions also. Like we have belladonna, we have hyoscyamus, we have stramonium also, or we have chamomile also in clinched firmly. Now, if you have a case where the patient, had the symptom clenched the teeth or jaw firmly, especially at night, and in that case, hydrocyanic acid worked very well. So these are very, very intricate and very, very interesting rubrics that you have to differentiate. When you see the patient, you observe the patient. That's how you basically make a difference in what actually you see. If somebody gives you a case and writes that I feel the patient has a habit of flinching, but actually it is biting, that you can see in front of you. So there's a difference. So the remedies also differ. Clenched firmly, clenched together, biting, difference. So this is what I have seen in my practice. Okay, I was just talking about discoloration, and whenever if you see a case and you find that the teeth are discolored black, and if the patient has come to it with disease of psychosyphilitic disorders, so this black discoloration also becomes syphilitic. Now it is not black discoloration when the patient has taken a lot of iron tablets, lot of iron syrups, and we have children who have teeth which are discolored black. These are because of iron intake. But actually, when the teeth, I have seen a lot of cases discoloration black. Especially, I have seen a lot of cases of melasma where I have used this rubric discoloration black, and the remedy which I have given is China, and it has worked wonderfully. So China is there, Muxol is there, fluoric acid is there, steficegri is there, thuja is there. But in melasma, where it is sometimes become difficult to cure those cases, these entry points of teeth are very, very important. Okay, I hope you understood this something in your practice. You will definitely have these type of cases coming in front of and a very interesting case where the patient said that I have what you call lining in my teeth. Like you have lining in your nails, you had lining in teeth. So we have rubric that discoloration brown, lining type. And then the remedy sometimes changes. Again, of course, fluoric acid in China is also there, but the remedy also changes. You can say brown lines and all. Then you have natrum floor and thuja also in those cases. Good afternoon, Meera, Prajakta, Megha, Dr. Vaishnav, Jyoti Vaishnav, Alexander. Thank you. I hope these are the very interesting. These are the very interesting entry points. In fact, I had a case where the teeth, in the front teeth was very much white, whiter than white. It's like writing on the blackboard, and it's like chalk white. If you have chalk white spots, remember, don't forget the remedy fluoric acid. Fluoric acid is most of the time taught because of that black discoloration, black caries, and black. But when the teeth discoloration is chalky white also in spots, you will have lot of cases, then it is fluoric acid. And if the same chalky whiteness is basically in stripes, the remedy is calcarea fluor. These are very, very minor difference that you have to understand in your practice, because these are good entry points. When in case taking you have asked lot of cases, and you find there's nothing important you have found in the case, and then we try to make rubrics from symptom. And when you try to make rubrics automatically by symptoms, of course, you can always have elements from what you call suppressed anger, and we have the rubric. Everybody has that. So don't try to make rubrics. See what the body is trying to tell you, and when the body is trying to tell you, you can see that in the body. Automatically, the remedy changes. And just match the miasms. Miasms are very, very important. So these are the few cases which I wanted to discuss. We had a lot of questions on WhatsApp about that, so I just wanted to complete that. So can we have some questions? Otherwise, I'll keep on going to my turn. Dipali Raut, welcome. So can we have some questions? Few of the doctors which have not, Dr. Ramdeve, welcome. Dr. Korane, welcome. Yeah. So can you have some questions before we stop? It's already 15 minutes up. Or you want me to just carry on with the Mater Medica? Yes, anybody? Any questions? We don't have any. See, if you ask questions, that I also, yeah. So there's one question. For chipped teeth and weak enamel, can we give calcarea floor? See, don't, if you see, basically, if you have, I cannot tell that you cannot give a particular remedy, because one remedy could have a lot of other, indications and a lot of variety of symptoms. But if you basically have seen the repertory, if you have read the Mater Medica fluoric as calcarea floor, you can say we have teeth breaking off. There's a fantastic, rubric calls when the teeth try to break off. Hey, doctor साहब ये मेरा दांत का पार्ट है ना टूट गया है. Teeth break off. Remedies calcarea floor, remedies fluoric acid, remedies I think acid sulf, and remedies syphilinum also. But sometimes, see now understand this the differentiation now. Sometimes the teeth do not break, they crumble. मतलब ऐसी दांत रहेगा the teeth and they go inside and they become distorted. They crumble, they don't break. And then you can take that symptom crumbling. Teeth are crumbling. Again, in teeth of crumbling, the remedies calcarea floor, fluoric acid, calcarea carb. Of course, then staphylococcus borax are also there. But these remedies are also there. If you take a generalized view of teeth complaints, calcarea floor will cover most of the complaints of teeth, because of course calcium is there, and most of the calcium of the teeth is calcarea. So calcarea floor, calcarea carb are remedies which basically will come in more, or silicia, which will come in most of the symptoms of teeth complaints. So just try to differentiate different rubrics. One rubric in this, I would like to tell Dr. Meera, we have done crumbling, we have done brittle. One more teeth is deformed and distorted. Teeth coming very wayward, triangular, rectangle, horizontal, tilted, distorted teeth. And then if you have a case of distorted teeth, the important remedy is syphilinum. So I'm not doing Mater Medica on teeth. Okay, you can ask me other questions also, because otherwise, it's all teeth. Doctor, please throw some light on dentition. Yeah, I'll do that. Dr. Korane, Dr. Wildflower, welcome. Yeah. Dr. Pritol Munshi, welcome. I'll just take one question on YouTube. Which remedies come to mind for frantic restlessness, staging chill that comes at around 5 p.m.? First of all, when there is frantic restlessness, there is one rubric in the repertory, dromomania. When the patient does not walk, it runs. Second, you can take the rubric, simple rubric, activity, desires, and you can take the rubric one, hyperactivity. But in your case, dromomania would be very important. And at 5 p.m., I have never seen a remedy, no prescribed that remedy. But you can take evening aggravation in those rubrics, and you can get the remedy. Okay. Caries of reed on the front of teeth. Yeah, if these are the cases, we have remedies in front of the teeth. You can definitely have fluoric acid, calcarea floor, staphylococcus, thuja, Muxol. Those are there. But just go beyond those symptoms. These remedies will come. But how will you enter the case apart from this? So in this case, you can basically prescribe the remedy asking some more few symptoms. Like whatever I said to Dr. Alexandra, impulse to run. The patient is so active, he has to run. So we have remedies, of course, Stramonium is there, Viratrum is there, Tuberculum is there, Hyoscyamus is there. This is there. But exactly 5 p.m. I have never read actually, but you can take basically in the evening and you can get the remedies, Sir, please explain about the select potency and repetition. Yes, dromomania, yes. You can go to the rubrics impulse and then run to dromomania. In dromomania, violence is there, iodum is there, running up and down, calcarea is there, running and hiding. I think it is there is a rubric and there's a very interesting remedy. I've only prescribed twice in my life. It was a case of migraine. I think millilotus is there. You can always confirm. I'm not getting the remedy. Dentation in children's. No. See, dentation in children's. There are lot of remedies. But if you want something in relation to children's, there are 5 6 remedies which I have used very commonly in my practice, and I have got fantastic results. Uh, yeah, I'll just come to that question, Dr. Suman. So you can think about all calcareas: calcarea floor, calcarea phos, calcarea carb, creosote, staphylos aureus, plantago, and floric acid. These 7 remedies in case of children's very very important. As I told you, importance of calcarea, calcareous phos, carb, floor, all calcareas are very important. These remedies are very very important. Okay. Potency selection depends on the case. Normally, I start with 30 potency or 200 potency, and that's all. And if I need repetitions, I always tell you use the LM potency. Uh, Pro Healthify Care Clean. Sir, please suggest remedy for high cholesterol and LDL. Is as you know, basically it's basically a problem of metabolism. So the whole case taking is very important. But I have seen a lot of cases of cholesterol. Like I have seen a lot of seminars where they use cholesterinum for high cholesterol. They use calcarea carb for high cholesterol. They use vanadium for high cholesterol. They use remedy called what do you call zincum metallicum, and use remedy like natrum mure because of that hereditary history, and silicia for high cholesterol. But I would suggest you to basically go for the case, and if you're not getting the case, then I think cholesterol basically lots of people prescribe. I don't know the result because I don't prescribe so oftenly now. I go basically with that one dose therapy. Yeah, thank you, doctor. Hi, doctor. Please suggest remedy for extreme prostration fatigue. Yeah. So if you have seen in this 1 month's time, we have seen so many cases of viral fevers, and the most important symptom is extreme weakness. The patient is not able to get out from the bed also. So whatever would be the CBC count, whether the patient is dengue positive, XYZ, very good results with muriatic acid, very good results with arsenic album, very good results with China Ars and Euphorbia perfolitum. Most of the cases of dengue which I have treated in my clinical practice, where the platelet count was as good as 20,000 also, we have cured these cases with these 5 6 remedies. Of course, there are other remedies also which I have used, but these 5 6 remedies very useful in your practice. Just try to differentiate, and you'll be able to cure a lot of complaints. A lot of cases of dengue I have cured in OPD also. A lot of cases. Sir, 2-year-old child, constipation every alternate day, has to strain to stools, perspiration with stools. Yeah, if there is constipation in children's, for few remedies, of course, I've told you opium is there, leg def is there, calcarea carb is there. Uh, I suppose a very easy symptom, you can go in that repertory and click and you'll get the remedies. But these are the very classical remedies which I've seen, and they've given me good results. Alumina, calcarea did not work. Fantastic. So in this case, yeah, so if this is very important. Now, if alumina did not work, if which calcarea carb did not work, now comes a time where you have to understand how is the constipation and why is the constipation. In constipation, you have to see, if you want remedies, you can write down. I can give you a lot of remedies. Like we have calcarea, we have nux vomica, we have natrum mure, we have silicia, we have plumbum metallicum, we have opium, and we have. But in this case, you try to understand why there is constipation. Bottle feed babies on artificial food early in their childhood, baby which have not been fed by mother's milk. These babies, if they suffer from constipation, then opium nux vomica works very well. If there is a constitutional history in the case where maybe there's a family history of constipation, then calcarea floor, chamomilla, graphitis works very well. If the constipation, if everything is normal, but the patient is in habit of taking a lot of milk, new babies, then silicia, hipersulf, graphitis, these are very very interesting remedies. Obstinate constipation, of course, very painful. Then you can think about veratrum albos. So there are a lot of remedies which you have to differentiate and then prescribe. Okay. For premature ejaculation, you can think about very, first of all, premature ejaculation, you can think about the patient suffering from psychological impotency also. In this case also, he's very hyper. Impatient type of personalities, impulsive type of personalities have these type of problems. So don't go with that symptom of premature ejaculation, go with the mind. Automatically you can cure these complaints. You can think about argentum nitricum, you can think about chamomilla, you can think about nux vomica, yohimbinum, sulfur. All remedies would be important. Priyanka, welcome. Any treatment for warts? Don't ask that question, doctor. Lot of treatment for warts, lot of remedies. Of course, it takes time to go. Different types of warts require different type of remedies. Eats mud, dry heart. You can think about, if this is the case, you can think about Naxomen, you can think about Chilidonium, you can think about Natramur. Sanicula might work. Yeah, it would work, yes. Sanicula stools, remember the stools are very hard, square shaped, so much square shaped as if carved by knife. That is Sanicula. Thanks, sir. How this case is not related with dengue or any disease? This is chronic case around 5-6 years. Patient can't do any work even daily. Oh my God. So very nice. So see, this is the case of weakness, and if you go to see wherever there is weakness and the case is about 5-6 years, that means you have to find out why the patient is weak. 2 or 3 things you have to find out, very important. Is the patient working as a literally person, doctors, lawyers, teachers, lot of mental activity, or the patient had suffered from acute viral disease or any disease like typhoid, malaria, jaundice, and after that the weakness is chronic. Third, you have to see whether the patient is suffering from he has a job where he has to work night shift, and then we have elements from night watching and elements from not sleeping properly, then also there is weakness. So in this, or elements from grief. So in these cases you have a wide variety of symptom to choose from one of these symptoms, and I think you should be able to cure that case. Some questions have been scrolled up, so you can always write the question again. Okay. So, yeah, middle-aged person complains of going to stool immediately after eating. Nothing for that. So if there is no cause for weakness, if there is weakness is causeless, and that is very surprising. But if it is causeless, then make sure that you diagnose the case, because there are some disorders where the weakness is because of some cause. For example, when there is extreme prostration and there is causeless, I have found most of the cases who get well with sorinum. So do take some genetic test why the patient is weak, and if the chest test also normal, causeless, I have found very good result with sorinum. And if it is causeless, the cause lies in the mind. Do take the history of the patient. If the patient is very diligent, conscientious, he will never tell you that I've been working day and night for my family. He feels it's okay, everybody has to work, so I'm also working. My friend is also working, so why he is not having weakness? But in that case, non-verbal communication will give you good results. Understand that. Dr. Razia, welcome. Gout remedies. See, there are a lot of remedies for gout. You can think about some easy remedies like benzoic acid, colchicum, artica urens, epismel. A lot of remedies for gout. In gout treatment, make sure that you first of all, when you are trying to treat a gout case, make sure that you stop the protein intake. The patient is having non-veg and all, so maintaining cause has to be first taken care of. Then automatically gout gets cured, and it's a curable condition. Don't worry. Stools after eating 5-6 times. Whenever the patient complains, stools after eating, there are a lot of remedies. First of all, make sure when the patient is suffering from IBS, there's anxiety. In case of IBS, you will find a lot of cases where the patient tries to eat food, especially more of proteinous food like milk and milk products, these type of food, and automatically the patient goes for stools after that. So you just rule out the condition, because otherwise, we will give. I'll tell you some medicine, like we have medicine like China, we have like Colocynth, you have Pulsatilla, Podophyllum, Natramas, lot of remedies. But it is very important, that it's like Ferrum Metallicum also. From the table he goes to it. but make sure that the diagnosis the patient is suffering from either some food allergies or ulcerative colitis or irritable bowel syndrome, and that's how the case taking has to be done, and then automatically you will get the remedies. I had a very interesting case. The patient used to come and tell me that whenever I eat food, after eating food, मेरी machine चालू हो जाती है. He starts passing flatus. And I failed in 2-3 remedies, but I prescribed the patient a single dose of then sepia that cured the case. So in this, case taking is also very important. Case taking, cough, fever. See, whatever is the first presenting symptom, Dr. Tag, I don't know the name. So whatever is the first presenting symptom, that is very important. Because when the patient complains about, for example, maybe weakness and fever, the patient takes paracetamol. After 2 or 3 days, he comes to you. So he's already suppressed that soric symptoms with that paracetamol. So the body will throw out some other symptoms. It is very important to make sure what was the presenting symptom at that time. Then see the modalities, see the thermals, and see the change from what the patient was and what is the patient now. You'll get the remedy. Okay. What do you recommend for a quick clean out? Maybe something to clean up your colon. I don't prescribe any remedies for that. Basically, whenever I want to tell the patient to clean the colon, I tell the patient basically eat more of salads and fruits and drink a lot of water. That's how I would suggest to clean the colon. Any other pathological test you would like to suggest for CBC, B12, BP, sugar in case of fatigue and prostration? See, whenever the patient is suffering from fatigue and prostration, do a CBC which you have done, and in that if you get some problem in the lymphocytes or monocytes or whatever it is, then there are different tests. So depending on that reports, we can further tell the patient to do the reports. Okay, so I hope you got it. Dr. Allen's welcome. Yeah. Very nice questions. Can we have some more questions? But in this case, I would say if all the reports are normal, Dr. Suman, make sure that you go through the mind. That's very important. In this case, it appears that the mind is having some problem, and in these cases, we have weakness from grief. And in these cases, weakness from grief, we have ignitia and natriumur also. Yeah, I just want the reports of CBC. There might be some problem in that. Otherwise, it's a constitutional weakness. Then go for a constitutional remedy. Always ask, how did the weakness start from day one, and something passed before the weakness 6 to 8 months or 1 or 2 years back, and that is the entry point of your case. So you have to ask that part. A question on WhatsApp. I'll just see what is that. Yeah, the same question. Yeah, so it's always the same question of fever and dengue fever and all. Just don't go for the name dengue fever and just start giving carica papaya, mother tincture or potency, because it's not like when you give carica papaya and everything would be fine and the patient the platelet will increase. It always occurs gradually. Make sure that the fluid intake is, as already stated in our books of medicines, 4 liters of fluid intake is very, very important with your medicine, so that there is no dehydration. Hydration has to be there, and with your medicines, it works. The most important symptom in dengue, after 5 days when the fever is absolutely normal, everything is normal, then the platelet starts going down. In those cases, do a CBC and watch about the TLC. If the TLC goes down, there's no problem with that. It will come with the medicines, but make sure when the TLC goes down, the patient is not exposed to any infective area, because when the TLC goes down, the body gets infected very fast and the patient dies because of the complication of the infection rather than dengue. So the watch the WBC, the TLC count. If that goes down, make sure that you tell the patient be at home. Nobody should meet the patient, because the body is very susceptible to infection. That is a very alarming period where in 2 days you have to make sure that there is no secondary infection in that dengue patient. Okay. Okay, so I think everything is most of the questions have been answered. And Dr. Suma, if you can share the reports of CBC, we can get the entry point, what to check and what not to check in that patient. Okay, Dr. Akram, welcome. So I think we missed last YouTube and Insta live. Maybe on Sunday I'll make sure that what is missed, I'll again do that, so that the whole 2.5 hours, I feel that I've never missed an Instagram or YouTube live. Okay. So thank you very much. We are already half an hour up. Thank you very much for joining, and I hope you enjoyed hearing me as much as I enjoy sharing my knowledge with you. Thank you so much. So tomorrow, hopefully, we'll meet. I'll just send that notice of template or the intimation on either WhatsApp or my Facebook. Thank you so much for joining. Thank you.